My name is Jillian. I am a nursing student at Northern. I am in my second semester of my clinicals, so I'm in my Med-Surg 1 semester, and I'm here to tell you about my day. So today was a hospital day. I have 2 days of clinicals where we're in the hospital working with patients, and then the rest of our days out of the week are just lecture days. We have one in-person lecture and then one online lecture. It's all blended, but all of our clinicals are in person, either at the hospital or we do stuff on campus. But this week I was on the 4th floor, which is cardiac. So I woke up this morning at around 6, got to the hospital at 6:50, and I took report from the nurses that worked there on the patient that I was assigned at around 7. And after that I did vitals. I took blood pressure and heart rate and stuff like that, and some blood sugars. And then I got my patient ready for her procedure. So I was lucky today that I got to go with my patient to her procedure. Typically we just stay on the floor with our patients and we do all their med pass, we do all of their cares. We basically do what the nurses do, either with the ones that are in the hospital working or with our instructor. But today I got to kind of branch out a little and follow my patient down to her procedure. So I got to see her heart catheterization, which is where they go in through an artery and they take like a wire and like a camera and some dye, and they take those through the arteries up into the heart, and then they either clear out blockage or they put some devices in there to make it so that she has better blood flow. So I got to see that, which was super cool, and ask a bunch of questions, and it was a good learning experience. And then I followed my patient out into recovery, and at that point it was probably around like 1 in the afternoon. And then I went back up to the 4th floor, did some charting. We have to learn how to do all the charting for our patient, and we get that all verified by our instructor. And today we actually got to get out early, which was super cool. And then I came home, ate some food, probably gonna shower because it's a long day and scrubs aren't always the cleanest. And I will be doing some medical research homework today, just like some paperwork for that, probably after my shower. And then I will eat dinner, and then I'm going to a seminar on campus, and then I will sleep for many hours, hopefully. But that is my day. I hope you guys enjoyed hearing about it, and thank you.